Okay, this is the male genital. This is CPT 2020. This is the male genital section, very short section, very, very straightforward. Probably the most heavily used area of this is probably vasectomies, honestly. So here is the index. This is your organ or your body system. Starts very much outside in, not at the tops. Sometimes we start at the top and down. This starts outside in, so it starts with the penis. So you have incisions, destructions, excisions, introductions. Here are your circumcision codes, 54150, 54160. Pay very close attention. There may be an age, like 60 is 28 days or less. So this could not be done on an adult. There's also different processes. Your 50 uses a clamp or other device. Your 60 surgical excision other than clamp. So kind of pay attention to the differences there. Still in the penis, this is repair codes. Manipulation codes, generally this is for the foreskin. If a kid, young male, baby, young adult male, the foreskin adheres to the head of the penis, it has to be manipulated. So that would be what that is. Then we get into the testes. There's a left and a right of these on most men. So do your left and rights, exploration repairs, laparoscopic procedures on the testes, epididymis, tunica vaginalis, scrotum. There's a lot of different parts, but there's very few procedures on those specific parts. So it's a little bit easier in here. Spermatic cords, seminal vesicles, vas deferens. This is where your vasectomies would be in this, depending on your approach. Here's prostate again. So we had prostate in the urinary. We also have some prostate here. This is your biopsies. And then we have excisions. These are excisions that were not transurethral, not done through a scope. These are open. Or, correct, they are open. These are laparoscopic. And then other procedures. You do have one code for placement of needles or catheters into the pelvic organs, kind of a generic. And then kind of stuck in here are two codes. These are the intersex surgeries, male to female, female to male. And they're just all inclusive codes. So that's the male genital. We'll do just a few in here, and then we'll get into the female genital. So let's do physician resected diseased scrotal tissue. So scrotum is your body part. He resected, so that's going to be an excision. And it was diseased. I don't know if diseased is going to make a difference, but we need to go to our body parts. So let's go to the scrotum. Put that up here. And incision, that's not what they did. Resected is an excision. So excision here. Resection of scrotum or scrotoplasty, which would be a surgical repair. So this excision, 55150, does it. That's what they did. These are really, really straightforward in here. Let's go on and talk about the female. Okay, so the female, this is our body parts, has our index. Starts with, just like in the male, starts with the outside going in. So it's going to start with all that external genitalia, the vulva, perineum, introitus. That would be the absolute vaginal opening. You need to know your definitions: simple, radical, partial, or complete. This is a great reference to come back to, know that it's there. So for these body parts, we have incisions, destructions. This could be some condylomas or something on the vulva. Excision codes, repair codes, endoscopy codes. So colpo means vagina. Scopy is looking. So colposcopy would be a scope of the vulva. Then we get into the vagina. Same type of consistency. Incisions, destructions. This would be some of those lesions again. Excisions. An introduction. This is different. Maybe irrigation or insertion of something into the vagina or even a uterus. Repair. Sorry, I was reading when I saw that. Here's another word, colpopexy. This is 57280. Colpo meaning vagina, pexy meaning fixation. So this is some type of, maybe the floor of the bladder has fallen some. They are fixating the bladder back up in a better position. Manipulation, endoscopy or laparoscopy. Then we get into the uterus, but there are multiple parts of the uterus. So this is specific to the cervix of the uterus, the lower part. So here's endoscopy procedures, excision procedures. Code 57520. I again make notes of what would be included in that code. This code includes fulguration, D&C, and repair, if all of those things were done. Then we get into the body of the uterus, corpus uteri. That's the body of the uterus. This is where you're going to have your hysterectomy codes. So starting with code 58150, these are hysterectomy procedures. They are open procedures. They would not be done vaginally. They are open. Make note, you're not going to use a 50 modifier. This example, 58150, is specific to the tubes and the ovaries. But if you see, they have a parentheses S. So that means they are including the capability of removing both. So you wouldn't put a 50 on there because the code description already includes that option. Starting 58260 is your vaginal hysterectomies. So that's your approach, open or vaginal. Introduction, this is where you're going to find IUD devices, artificial insemination, lots of different things. Repair codes of the body of the uterus. Laparoscopic hysteroscopy, using a hysteroscope. That's all in here. Then we get into our ovaries. These first codes are our sterilization codes. So 58600 is ligation or transection of fallopian tubes. Ligation is a tying off. Transection would be a going through, cutting through. Laparoscopy for the ovaries, for that body part. Your excision codes. Repair. These types of surgeries on these small organs, very, very common anywhere in the abdomen to get adhesions. You've been cut into once, you heal up, you have to go in again. There's a lot of adhesions. The tissue got moved around, changed, and so it adhered to something that it shouldn't have. So very, very common to do a lysis of adhesions in these surgeries. Lysis means freeing. Here's your ovaries. So the difference. Your oviduct is your fallopian tubes. Just so you know the difference. So in this section will be your tubes and maybe a few ovary codes. This is strictly ovary. May include a few fallopian tubes, like 58956 includes bilateral salpingo, that's tubes. Oophorectomy. Oophoro is your eggs, so that's ovaries. So this is a bilateral, so both sides, taking out the tubes and the ovaries, and a total omentectomy with a total abdominal hysterectomy for malignancy. So that is very, very, very specific to cancer. They've just taken everything out. But you will see a few tubes in here bundled in with the ovaries. In vitro. Then we get into maternity care. So this is for pregnant females. Very good information here. Talks about antepartum care, that is before the birth, delivery services, and then postpartum. Here is antepartum, things that might go on during that time. Maybe you have genetic markers for something. Maybe the baby isn't growing like it should. Maybe you have too much amniotic fluid. Or just there's a million things that it could be. But this would be tapping into amniocentesis, so that would be drawing out some amniotic fluid. Cordocentesis would be going in and actually pulling out cord blood. Fetal stress tests, that kind of, fetal contraction stress test, and then non-stress test too. So just different stuff in here. Excisions. If you have a like this first one, 59100, they have a high datiform mole. So they may very well have tested positive for pregnancy, but it really isn't a pregnancy. So they're going to go in and take out that high datiform mole, which is interesting. You should read up on that. That's interesting. Make sure you know, like ectopic pregnancies, make sure you know your approach. Some of the codes include both approaches. It doesn't matter which way they did it. This is your ectopic. Your vaginal delivery, antepartum and postpartum. These are like code 59400, routine obstructive care, including antepartum, the delivery, and postpartum. But this is specific to a vaginal delivery. This is going to be that female that gets all of her antenatal care with the same doctor. The same doctor delivers her. She goes into labor, goes in, has the baby naturally or with an epidural, with or without an episiotomy, but in a very straightforward manner, no problems, and then returns to that same doctor for their post-op care. This code this is a vaginal only delivery. So your codes can be antepartum only. Maybe someone moves, so they get all of their antepartum care through one doctor. They move, so they have to find another doctor to deliver them. Maybe they deliver and then move right after they deliver, and they have to find somebody to provide their postpartum care. Some of these codes are for vaginal delivery only. The doc didn't do any prenatal care, didn't do any postnatal care. They've only delivered them. C-section. Then it gets a little specific in here. Delivery after previous C-sections. This is the abortion section. I don't have much to say about this. I do want to explain a couple of the terms. Code 59812 is an incomplete abortion. What that means is there's still retained parts or products of conception retained. So that's what an incomplete abortion means. 59820, a missed abortion, means that there's a fetal demise. The baby has died, and that's considered a missed abortion. Okay, then tucked away at the back of the female and maternity care is the endocrine system, which is kind of weird, but it's stuck back here. So this is the thyroid, probably one of the more heavily used body areas or glands within the endocrine. So what do we have to pay attention to? So our excision is probably the most heavily used. And I do a lot of underline because yet again, we have little tiny variations to the codes that can make all the difference. So if you look at code 60210, this is partial thyroid lobectomy unilateral. Well, if you know your body parts, you have multiple thyroid lobes. So if it's unilateral, then only one side partially got removed. Whereas 60220 is unilateral, but the whole side got removed. So that's the difference in these two. And then your 60260 is a thyroidectomy removal of all remaining after a previous. So maybe 2 years ago, the patient had 60210, had a partial thyroid lobectomy unilateral. Now, maybe diseases come back, I don't know, but they're going to come back in and do a total thyroidectomy after that previous one. So the parentheses underneath here, always read your parentheses, tell you that if it's a bilateral for this, then put a 50 on it. So maybe they did a partial on one side 2 years ago, and now it was just benign 2 years ago. Now it looks like cancer spread. It's converted into malignant instead of benign. So now they're going to come back in and just take the rest of that one lobe out and all of the other ones. So that would be a total. So you would do a 50 modifier for that. Down here, 60240, thyroidectomy total or complete. 60252, thyroidectomy total or subtotal for malignancy. So you have to, this for malignancy, you would know going into surgery. So they've already had a biopsy and they've proven that it's malignant. Then we go into the parathyroid, thymus, adrenal glands. Very few codes here. It's just one page. A little bit of a catch-all. But if you have, if your adrenal glands, which sit on top of your kidneys, if they get removed, that's in here. Know your approaches. These would be open. Then you have laparoscopic choices. And that's it for the male, female, and endocrine. So let's drill a little bit on the female. Let's see, what do we want to do? Let's do physician performed a tubal ligation. And it was a vaginal approach. Postpartum, bilateral, using the same, during the same hospitalization. So it is tubal ligation bilateral. Let's not code the delivery side of it. Let's just find the code that we would use for this tubal ligation. So let's get to our body part. So we want to get to our fallopian tubes. And then we're going to do ligation. That's a tying off. So ligation, fallopian tubes, vaginal. I don't know. I think we're going to have to, we'll come back to that one. 58605, ligation, fallopian tubes, vaginal approach. Okay, we got that. Postpartum, we got that. unilateral or bilateral during same hospitalization. So this is a separate procedure. So this is one of those times that we would get to put a 59 modifier because this was separate and identifiable. We don't have to put a 50 modifier on it because it says unilateral or bilateral. So that's the only code we would need for this. Okay, let's do another one. Physician inserted an IUD. So IUD tells me right off the bat it's going to be in an introduction or other procedure section. So that's going into, let me find my body part. A IUD goes into the uterus. So I want to get under my uterus, probably introduction. So here's insertion of an IUD, removal of an IUD. So we inserted it. So 58300. Let's do one more female. Physician performed colpocentesis. Colpocentesis. Okay, so we know centesis is a drawing off. Did I spell that right? Doesn't look right. I think it's right. Okay. Centesis is a drawn off of fluid. Colpo means vagina. So we're drawing fluid off of the vagina. That sounds kind of strange, but it's probably aspirating, not drawing off. So this is a colpocentesis to aspirate fluid from the peritoneum. So that's giving us closer to our body part through the vaginal wall. So this is through the vaginal wall. So let's get to our body part. Got to get to our vagina. So this is a colpocentesis to aspirate fluid from the peritoneum. So colpocentesis, 527. No, sorry, I said that wrong. 57020. Oh, sometimes I do that wrong, or I say stuff wrong. Just got to live with me. 57020. Oh my gosh, I said that wrong again. 570. Oh no, I didn't. I said it right. Colpocentesis, separate procedure. So because it says separate procedure, make very, very sure that this is the only thing being done. Okay? Okay, let's do something on pregnant women. I love pregnant women and I love, love, love babies, but I don't like taking care of them. That was not my area of nursing. So let me once they delivered it was. But that whole delivery thing, that's not my cup of tea. Okay, so here's our scenario. Let me be ready to write it down. Physician treated an ectopic pregnancy. So let me write that down. Ectopic pregnancy by removing the fallopian tube and ovary through an incision in the lower abdomen. So we removed tube and ovary through an incision. I got to write a lot on this one. In the lower abdomen. Okay, so let's get to our body part. What is our body part? So we don't want antepartum. So where do we? Yes, we want this area. So we are antepartum because they're pregnant now. It's just the pregnancy's in the wrong place. So we're going to be under our antepartum. This is our ectopic pregnancy section. So you can maybe flag it. I don't know. Whatever you need to do. Surgical treatment of ectopic pregnancy. So I know we're getting in the right place. Requiring salpingectomy or oophorectomy. So that would be salpingectomy is a tube, And oophorectomy is an ovary. And we did an incision in the lower abdomen. So this is abdominal or vaginal approach. So there's our abdominal approach. And we have ectopic pregnancy. So that's our code. 59120. I was able to mark enough off. Sometimes you work backwards. You think you're going to be able to work forward and you have to work backwards. It's just how things are. Okay, physician provided antepartum. Antepartum, 7 visits. And postpartum, but did not perform the delivery. So we're going to be in our antepartum and our postpartum area. So here's antepartum care, 7 or more visits. So that's 59426. Now we need our postpartum. I shouldn't have moved, should I? I always want to turn pages. That's another thing. Maybe other people are the same way I am. I always want to turn a page. So 59430. So we have 59426 and 59430. That postpartum care only, I'd stick a 59 on there because it's a separate procedure. So it theoretically needs to be the only thing done. These may or may not be billed at the same time. Would just depend. So that's how I would code that. Okay, now let's do a few of the endocrine, just so we can get our feet wet in that area. Let me find my hold on. I'm going slow. I don't know why. I'm usually not that slow. Okay, so here's our scenario. Physician determines the location of a thyroid cyst. Using palpation and aspirates it. So he's going to aspirate. So he's going to pull fluid out of it. So let's get to our body part. Thyroid. I'm not sure. I would imagine aspirating is a removal. They're going to remove fluid. So none of this thyroidectomy stuff, excision's gonna work. Here we go, aspiration or injection, thyroid cyst. So they're draining that cyst. So 60300. That one was easy, too easy. Okay, let's do another one. Physician removed the remaining thyroid tissue. One side following an earlier partial. So they had an earlier partial. So we know we're on our thyroid. We know we're excision. We're going to remove the remaining. So if you have the notes that I do, because I have a redo sitting right here, this is probably where I'm going to go first and see if my scenario plugs into there. So thyroidectomy, removal of all remaining from a previous. So that's it, 60260. So that's how that scenario would sound if you were doing it. Let's do one more in here. Physician surgically removes parathyroid glands. So parathyroid is our body part, and they are removed. So parathyroid, excisions is removals. So let's do a parathyroidectomy, ectomy meaning removal. And it's the first one. That was easy. See, these are pretty straightforward in here. Once you get a little familiar, so the code 60500, once you get a little familiar with the codes, it's easier to just plug stuff in. It's not too bad. Okay, so that is it, and I will see you in the next video.